Schizophrenia is one of the most baffling and misunderstood mental health conditions, profoundly altering how a person experiences reality, thinks, feels, and navigates everyday life. But here's where it gets controversial. Despite its complexity, many still hold misconceptions that can delay diagnosis and treatment. Henry Cockburn's story vividly illustrates the profound impact this diagnosis can have. Tracing his path from a carefree young man to someone grappling with schizophrenia and fighting to reclaim a sense of normalcy. In February 2002, Henry, then a 20-year-old art student at the University of Brighton, embarked on a barefoot trek from the city back to his hometown of Canterbury, roughly 70 miles away. After covering about 24 kilometers, he began hearing distant airplane noises and became convinced that a sinister force was tracking him relentlessly. He later told CNN, "Somehow a malevolent force knew I had gone," revealing the depth of his paranoia. In a desperate attempt to escape this perceived threat, Henry plunged into the icy waters of the New Haven estuary, hoping to swim away from the ominous presence. Fortunately, local fishermen found him before hypothermia could take hold and rescued him. Following his recovery, Henry was admitted to a psychiatric hospital where he was diagnosed with schizophrenia. This marked the beginning of nearly 8 years of hospitalizations and treatments across multiple facilities. Schizophrenia is a chronic brain disorder that, despite attracting significant attention, remains widely misunderstood and stigmatized. According to the American Psychiatric Association, it affects approximately 0.32% of the global population, about 24 million people worldwide. The illness typically emerges in young adulthood and progresses gradually, characterized by symptoms such as psychosis, delusions, hallucinations, diminished motivation, and disruptions in thought and speech. Henry once said, "In my view, schizophrenia is the most ruinous of mental disorders because it affects how a person reaches their potential." This statement challenges us to rethink the impact of schizophrenia beyond just symptoms, highlighting how it can derail a person's life ambitions and dreams. Unfortunately, stereotypes often paint people with schizophrenia as dangerous or beyond help, which is far from the truth. Society's fear and misunderstanding frequently obstruct early diagnosis and effective treatment. Most individuals with schizophrenia, even those experiencing severe symptoms, do not pose a threat to others. Clinically, schizophrenia symptoms fall into several key categories: delusions and hallucinations, disorganized thinking, incoherent speech, lack of motivation, and social withdrawal. Treatment typically involves a combination of antipsychotic medications to manage psychotic symptoms, psychotherapy to address thought patterns and improve social skills, and support services to aid daily functioning. While a complete cure remains elusive, comprehensive care can dramatically improve quality of life. After his final hospital discharge in 2011, Henry found stability through a blend of cognitive behavioral therapy tailored for psychosis, medication, and ongoing counseling. Together with his father, journalist Patrick Cockburn, he co-authored the memoir Henry's Demons, The Father and Son's Path Beyond Madness, offering a candid look at their shared journey through mental illness. Henry's message is clear and powerful: never give up. This advice resonates deeply with those living with schizophrenia and their families. He adds, "I always believe that even in the darkest moments, there is someone watching over you somewhere. You are not alone. Understanding the symptoms early is crucial to seeking timely professional help and preventing crises." Treatment strategies focus on reducing hallucinations and delusions with antipsychotic drugs, using psychotherapy to explore and reshape thought processes, and building social skills to improve interaction. Equally important is the support network, consistent medication adherence, open communication with healthcare providers, professional therapy, and participation in rehabilitation programs all contribute to better outcomes. Henry's experience shows that despite long and difficult battles, hope and progress are possible. With the combined efforts of loved ones and mental health professionals, he has managed to create a meaningful life that inspires others facing similar challenges. If you or someone you care about is struggling with suicidal thoughts or severe mental health issues, it's vital to seek immediate assistance. In the United States, the crisis hotline at 988 is available, along with local emergency services. Both the US and the UK have national and local mental health organizations that offer guidance on diagnosis, treatment, and family support. Numerous charities and volunteer groups also provide invaluable help to those coping with schizophrenia and related psychoses. Here's a question to ponder. Given the stigma and misunderstandings surrounding schizophrenia, how can society better support early diagnosis and ongoing care? Do you think current treatment approaches are sufficient, or is there a need for more innovative solutions? Share your thoughts and experiences in the comments. Let's start a conversation that could change lives.